I'm going to discuss a surgical versus conservative management of type 3 acromioclavicular dislocation. First, the objective of this study is to find the best evidence through reviewing the literature to support the effectiveness of either surgical or conservative treatment of type 3 AC dislocations. The method did perform a systematic review of the literature according to the PRISMA. 3 independent reviewers separately conducted the research. All journals were considered and all relevant studies were analyzed. They also performed a statistical analysis with Cascaret test using Yates correction and Fisher's exact test. They also compared the percentage of recurrence and persistence of pain for the nowadays for two most used techniques, hook plate and arthroscopic fixation. They also perform a statistical analysis with students' tests to establish whether the difference of the mean post-operative clinical outcome scores was statistically relevant. The discussion and the result. The literature search and cross-referencing resulted in a total of 315 references. 244 were rejected because of they failed to fulfill the criteria, and also another 32 articles were excluded. 22 articles describing patients with type 3 AC dislocations. The important finding of this study was the conservative and surgical management showed similar clinical outcomes, including persistence of pain, osteoarthritis prevention, and outcome scores. Though persistence of pain was less common in the group of patients managed with surgery. Among the surgical group, arthroscopic and hook plate techniques show lower rate of recurrence and complications compared with the older procedure. The conclusion, although persistence of pain seems to occur less frequently in patients having had surgical treatment for type 3 AC dislocation, there is insufficient support in the current literature to establish statistically significant differences in the effects of surgical versus conservative treatment on the functional outcome of patients with AC dislocation. Among the surgical procedure, the nowadays two most used techniques are the hook plate and arthroscopic procedures. The arthroscopic procedures have a lower rate of residual post-operative pain and post-operative recurrence, but even in this case, more data and therefore more studies are needed to support this finding. Recommendation, it is better to do the conservative procedure to avoid further complication like failure to redislocation due to erosion of the bone. Things that I've learned about journal. I've learned about this journal, those several advantages and disadvantages associated with conservative treatment. It includes the shorter period of rehabilitation, the freedom from hospitalization, and satisfactory functional results in general. The disadvantages were a moderate rate of persistent pain, instability and limitation of motion, and also if reconstructive procedure was needed, it was more difficult to perform surgery after a persistent period of displacement. This is the end of my slide. Thank you.